welcome to India Top Doctor. Today we are here to break down some common myths about infertility. And for that, I would like to invite Dr. Ashish Kale from Ashish Kale Hospital in Pune, popularly known for its incomparable services. So let's welcome him. Welcome to India Top Doctor.
Thank you. Thank you very much for having me here.
It is our pleasure, sir. So before we move ahead, can you tell our audience something about yourself?
Yeah, myself is Dr. Ashish Kale from Pune. I do IVF infertility cases. I'm a specialist into IVF and endoscopy. That is a gynec endoscopy. I'm a director of Ashish Kale Hospital and Asha IVF centers across the globe. We are having the centers in Dubai, Congo, as well as Indonesia. To my credit, I have the first baby of Arunachal by IVF technology. And I'm presently leading organization of Pune OBGYN Society. I'm a secretary of it. I hold the position of executive member of a national body of ISAR, that is the Indian Association of Reproductive Sciences. I'm also executive member of IAG, that is the Indian Association of Gynec Endoscopies.
Yeah. Congratulations on all the successes you have achieved till now, sir.
Thank you. Thank you very much.
As you know, today we'll be breaking down a few myths regarding infertility. But before we do that, can you tell us what is infertility?
Basically, when if you talk about the layman language, if the patient is having a regular sexual activity and unable to conceive in a period of 1 year, it's called as infertility. But it depends upon the age also. If she is going to get married at the later age, suppose she is at 38 and 39, and in a 6 months they are planning for a baby and not having the baby in older age for a 6 months gap also, the term is as a infertility patients.
And there are some myths regarding infertility. Number one is infertility is typically women's fault. Is it true?
Yeah. I never believe, because when you're talking about infertility, it's a couple problem. It is nothing to do with the male and female. And now we are in the era where the equality matters. So if it is a problem of a couple, it is addressed to the couple. So it's never been it is a female problem. It is a problem related to the male also, as well as the female also.
Also, using birth control can cause infertility. Is that true, sir?
If you ask me very precisely, oral contraceptive pills in which age group and in whom you are giving, that makes a point of interest. If she's on adolescent age group, suppose she is 18, 19 or 20 years girl and started using oral contraceptive period tablets for regularization of the periods for that matter, it doesn't affect at all the fertility outcome or her potential to become a mother. But on the other hand, if she indulge into unsafe sexual activity and going for the abortion pills or maybe for that emergency contraception, that may hinder in her endocrinological balance and will have a little bit impact on the fertility issues. But not like OC pills use will cause infertility. It's not like that. Not also the duration of it.
Okay, sir. The next myth, I think, is rather more gives a feeling of patriarchy. That is that if a man can ejaculate, he is not infertile. Is that true?
The man ejaculate, it doesn't mean that particular ejaculate is going to have the sperm in it. Because every man in an age group of a different age group is going to get ejaculations. And the ejaculation is coming out the semen sample outside the body. That's what we know. But in that particular ejaculate, you need to have the sperms. And not only the count matters, there is a morphology that also counts when you're talking about infertility. When you're talking about an ejaculations, that there is no ejaculate at all, then it's a cause of infertility. And the erections problems in a male definitely is a problem, because if there is a erectile dysfunction, he is not able to do a proper sexual activity. And that is the cause of infertility. Yes, that will related to the different group of the patients.
All right, sir. And would you say that infertility cannot happen in young men or women?
Nowadays, if you observe amongst youngsters, there are the two problems that's venture into our society, for that matter, in the world, is obesity, and secondly is our working style. My majority of the work is been done in the night, where usually the people is going to have the sound sleep. But if you are in a working style is in the night, and then you are sleeping in the day, it will cause a disturbance in your hormonal system, and that will going to have the infertility problem. And secondly, I seen the age of 23 also, the ovarian reserve, that is called as the how much eggs are there in your ovaries, that will decides your deciding factors. So age is a number, but when you're talking about the age in relation to the infertility, it can happen to any age. I seen age at the 23. Having said that, there is no count or a less count of the follicle, that is what we call as an antral follicle count, or AMH, which is a predisposing factor for giving the treatment for infertility.
Okay, sir, there is one last myth, and it is rather very common, that women cannot get pregnant after 35. Is that true, sir?
When you call as a myth, will say into another word, it's not a myth. It's depend upon the age. When it is more than 35 age, it is depend upon the quality. What is the quality of your egg? More is the age, the quality of the egg is decreased, and that is the one of the thing that needs to be addressed to the all the people who is watching me or who is going to watch me later on, because the quality of the eggs will go into the your offspring, the chances of mental retardation which will be on a higher side as compared to the patient who is at a younger age group. Secondly, age at after 35 will lead to a predisposing factors. She may have underlying diabetes or maybe hypertension, and that will gives a trouble in her journey as a mother.
All right, sir. Thank you so much for breaking down those myths and facts, giving us some real facts. And at last, I would just like to ask you any message you would like to give our audience.
I will give only a three-line message. First, if you are going to go for your marriage or you're thinking of marriage, better to have the child at an early age group. You can build up your career, you can do everything you want, but the God has given you a potential to reproduce in certain age group. And if at all you don't want it to get married, it is better to do a cryopreservation of your gametes. You can cryopreserve your semen sample. You can cryopreserve your eggs. So at the age of 40 also you can have the healthy baby. So it's a essential that you need to meet a IVF expert, to meet any of those. Take your advice, which what you want in life, because nowadays the girls are also going to have a different education, higher post, and they're having a much more good opportunity in the life. So I want for them, if you wanted to achieve everything in the life, the same thing you should achieve your beautiful next generation. So you can cryopreserve your gametes, and that can be used in a later half of your life. And you must, if there is any problem related to the sexual activity, related to your the semen samples, related to your what you call as relationships, it is better to talk to the doctor rather than keeping it to yourself, because early you approach, it is better to have the outcome which is good in expert's hand.
Thank you so much, sir, for this wonderful session. And you gave us really a wonderful message too. Thank you so much for being here with us.
Yes, thank you. And I really request, if there is any queries, you can just contact me. That is, if you type Ashish Kale Pune on a Google anywhere, you will find my name. So please do contact, and I'm happy to answer any questions.
Absolutely, sir. Thank you so much.